Hi, everyone. I'm Dr. Max Polyak from the Sea Turtle Rescue Alliance, welcoming you to our next series of medical discussions that we host about bi-monthly here at the Alliance. Before I introduce our guest, I'd like to just share with you the objectives of the Alliance and what we're up to these days. Our main focus is to support rescue centers and other facilities around the world in the admission, care, medical treatment, and release of sea turtles, with a special focus on educating professionals in the field in sea turtle medicine, rescue, and rehabilitation. And kind of overarching all of that, we hope to improve sea turtle welfare around the world. We've grown now to, we have 16 affiliated centers, and we've just launched our SharePoint site, which is a online resource database of all things sea turtle medicine and sea turtle husbandry related, and we're very excited about that. We also are in the beta phase of our cloud-based medical records, clinical medical records system, via ProVet, and that should be rolled out in a wider capacity later this year. So we are growing very nicely and really excited about our future, and we encourage you to log on to our website if you're interested in joining, SeaTurtleRescueAlliance.org, and you can see all kinds of really fascinating things on the site. So with that, I'd like to introduce our next guest. I'm super excited to introduce Dr. Heather Barron, who is going to be speaking on brevetoxicosis and a novel therapy to treat that. Dr. Barron was born in Georgia, where she completed a residency in non-traditional species at the University of Georgia's College of Veterinary Medicine. She later became a tenured associate professor at the college. Dr. Barron also gathered rich international experience as a professor and department head of clinical medicine at St. Matthew's University School of Veterinary Medicine, as well as she also served as a veterinarian for the Cayman Turtle Farm and Cayman Wildlife Rescue. Since 2011, she served as the medical and research director and head veterinarian for the clinic, the very famous Clinic for Rehabilitation and Wildlife, also called CROW, on Sanibel Island in beautiful Florida. And she is also board certified in avian, as a board certified avian specialist and a certified aquatic animal veterinarian. Currently, Dr. Barron is the chief science officer and veterinarian at the Loggerhead Marinelife Center in beautiful Juno Beach, Florida. So without further ado, I would like to share the screen with Dr. Barron, and let's hear this fascinating discussion on ILE therapy.
Good morning, everyone. Thank you, Dr. Polyak. And I am excited to talk to you guys today about brevetoxicosis. So let me share my screen here and we will get started.
Today we're going to be talking a little bit about brevetoxicosis in sea turtles. And I have to tell you that most of my experience with dealing with brevetoxins in sea turtles comes from the time that I spent at the Clinic for the Rehabilitation of Wildlife, or CROW, which is located in Sanibel, Florida, which is actually on the west coast or Gulf Coast of the state of Florida. So I was there for a decade as the head of research and chief veterinarian there. And so a lot of my experience is from my time. And when you look at harmful algal blooms, the definition of this is algae that blooms out of control and in some way harms the ecosystem. Now, obviously, most algae are not harmful to the ecosystem. There's obviously hundreds of species of algae, and most of them are a really important part of the food chain. However, at least in the Gulf of Mexico, approximately 2% of all algae can potentially be harmful. And harmful algal blooms can occur in any coastal states, but they can also occur in inland lakes. And potentially they may color the water, as you see in this particular slide, but that doesn't always occur. So you can't necessarily just look at the water and know whether or not you're having a harmful algal bloom, although sometimes you can. And certainly of the 50 different HAB species that occur in the Gulf of Mexico, one of the most well-known species is Carenia brevis, which is the causative agent of the Florida red tide. Now, in terms of Carenia brevis, this is a dinoflagellate that results in the release of a host of brevetoxins, which are actually neurotoxins. And although red tides are somewhat rare over here on Florida's East Coast, they are actually quite common on the West Coast or in the Gulf of Mexico. And here you can see one example over in the Gulf of Mexico where this red tide is in fact discoloring the water and is really obvious. So obviously water is one of our greatest resources here on Earth, and it is also one of our biggest potential problems. So there are more people who die from poor water quality every year than from all forms of violence, including war. And this is just a really great image of looking at the coast here of Florida from the air, and what you're seeing is discharges from our largest lake in the state of Florida, which is Lake Okeechobee, and those discharges coming down and coming out in the Gulf of Mexico here. So you can actually see a really obvious line where that discharge is moving into the Gulf. And when we look at why are we having so many problems with harmful algal blooms, because certainly we are seeing harmful algal blooms reported more and more. It's causing more of an impact on marine mammals and sea turtles and other aquatic animal life. These blooms are lasting for longer. They're occurring more frequently. They're occurring over larger stretches of ocean. And so why is this happening? Well, there's probably a variety of reasons for that. The first is that we historically had a very different flow of water, at least here in the state of Florida. So what you're looking at here is the historic water flow in Florida through the watershed down to this very large lake, which is Lake Okeechobee, and then down through the Everglades and out into the ocean. And back in those days, there was no St. Lucie River that led from Lake O out to the East Coast, and Lake Okeechobee did not have any connection to the Caloosahatchee River. And what we saw was that because there were problems back in the 1930s with Lake Okeechobee overflowing its banks in some hurricane instances and causing a lot of significant damage, not only to human habitations, but also to the agricultural area. Then they went ahead and built a dike around the lake and then had two methods of discharge. So they actually went ahead and hooked the Caloosahatchee River into the lake, and then there are a series of weirs that control that water flow out to the Gulf of Mexico. And then they also built a man-made river called the St. Lucie River, which allowed water to be discharged out onto the East Coast. And what we see is about 70% of the flow from Lake O goes to the West Coast, and only 30% goes to the East Coast. So maybe not surprisingly, we see a lot more harmful algal blooms on the West Coast. And because of this change in the historic flow of water, The Everglades are actually dying more and more each year as there is more salt erosion of the Everglades and more drought that the Everglades are dying from. And we are also seeing that, the Everglades served as sort of a natural filtration method for this water. And as it trickled down through the grasses, it was basically cleaned by that very loamy marsh. But now there really isn't any way for that water to be cleaned of its very high levels of nitrogen and phosphorus before 70% of those discharges from Lake O are dumped onto the West Coast. And so, again, not surprisingly, if you look right here at the mouth of the Caloosahatchee River, this tiny little speck is Sanibel Island, and so not surprisingly, Sanibel is really an epicenter for red tides, and we see them quite frequently. And again, all the way up and down the West Coast, but this is probably one reason why they are so bad there. And obviously, red tides are nothing new. They've been described in the literature as far back as the 1500s. However, this is certainly an instance of a natural phenomena that is being made much worse by anthropogenic factors. And so what we see is that you have more fertilizer runoff and more animal waste. And so this increases the amount of nitrogen and phosphorus. And obviously, algae as a plant responds very well to these fertilizers with increasing the amount of algae that you see. And so you get a bloom. And again, some of these blooms are very harmful. And we can see impacts from these blooms on human health, on recreation and tourism, on commercial fisheries, and certainly it costs a tremendous amount of money to monitor these for these red tides or other harmful algal blooms when they occur, and to manage them after they've occurred. But one thing that is not included in a lot of the studies that have looked at impacts on states suffering from harmful algal blooms is the cost of the impact on wildlife. And so that has really become an area of research and collaborative focus for us here at Loggerhead Marinelife Center, and certainly it was for us on Sanibel Island as well. And all of the images that you see here are from that 2018 state of emergency that was declared in the state of Florida with these harmful algal blooms. And here you're seeing a whale shark that was affected and had very high levels of brevetoxin, a loggerhead sea turtle, and some Goliath grouper with here the Sanibel Lighthouse in the background. So very iconic images that I borrowed from SCCF. And when we decided to make this area of research focus, we really wanted to understand better the clinicopathology of what was happening with these brevetoxins and also look at improved treatment options. And so obviously one of the reasons that it is important that we understand more about these harmful algal blooms is so that we can prevent humans from being harmed by them. Unfortunately, wildlife really can't read, and in the case of sea turtles, they really can't stay out of the water either. And so this is obviously problematic, and so we need to find a better way of keeping our waters clean. But we're really fighting an uphill battle with that because the population of the state of Florida is over 21 million people currently, and over 1,000 people a day are moving to Florida. And so not surprisingly, this has resulted in over 97% of Florida's bays and estuaries and over 40% 30%, 2% of her streams being considered to be in poor shape or not safe for swimming or fishing. But it's not just a Florida problem. Recently, a UN report stated that over 71% of the world's natural wetlands are being lost. And because of that, there is a degradation in water quality that surrounded those wetlands because, again, we've lost that natural filtration effect. And so because of this, we're seeing a lot more of these natural biotoxins out there in the ocean. And not surprisingly, that is posing a risk to sea turtle health. And there was a great study that Peralt et al. Put out from here at LMC back in 2017, where they showed that there was a positive correlation that was observed between brevetoxins and between both alpha globulins in Kemp's Ridleys and alpha and gamma globulins in green sea turtles, which indicated they were having some level of immunostimulation. Additionally, they found that brevetoxin levels actually correlated positively with total tumor scores of green sea turtles afflicted with fibropapillomas. So some very interesting findings there that we will hopefully follow up on in the future. And again, I'm just going to hop back real quick to that 2018 state of emergency that was declared here in the state of Florida, not only for red tide, but that year we also had a terrible problem with blue-green algae. And this particular red tide went all the way from October of 2017 all the way into early spring of 2019. And so usually we're fairly lucky to some degree with red tides because they usually occur from October all the way through to April, which is the opposite of the sea turtle breeding season. And so usually that means that most adult animals are often not exposed. But in this particular year, it was obviously really bad. We had a lot more animals in nearshore waters, and so a lot more loggerheads being affected, Kemp's Ridleys being affected, and a lower percentage of green sea turtles being affected. But in that particular red tide event, which again lasted year round, there were the most sea turtle strandings that had ever been recorded. So well over 1,000 were recorded, and so it was obviously a very devastating time. But the silver lining to all of that was it provided an excellent opportunity for us to do a variety of broad-ranging research on these particular topics. So how are sea turtles exposed to red tide? Well, a lot of marine turtles are exposed to brevetoxins through potentially to some small degree, perhaps through inhalation of aerosolized toxins when they're up on the beach nesting or when they come up to breathe the air. Or again, to a lesser extent, through ingestion of water as they're feeding. But predominantly, probably the major route of exposure is through bioaccumulation and ingestion of exposed prey items, like you see here with this loggerhead that is eating a lobster. And when these sea turtles present for brevetoxicosis, remember that these brevetoxins can affect nerves that are anywhere. So they could affect nerves in the central nervous system. And so this may produce clinical signs such as head bobbing, circling, ataxia, seizures, things like that. But it also can affect peripheral nerves. And because of that, you may see muscle twitching, paralysis, loss of palpebral reflex, certainly ileus and bradycardia may all potentially be seen. So what do we do about that? Well, in terms of being able to control red tides themselves, There really is no control strategy that is completely effective and acceptable there. And when we looked historically at some of the therapy that was recommended for sea turtles, the primary method of treatment was simply removal from the source of brevetoxin. So hopefully if you're having red tide in your area, you've gotten those animals out of the water and they're now in a closed system. So a lot of you, like some of our tanks here at LMC, are actually a flow-through system. So the water comes directly from the ocean, goes through some filtration, but that's not going to get rid of any brevetoxins that are in the water. And then it goes into the tank and then it flows back out again. And so obviously, if you're having a red tide bloom, you want to have a closed system. Additionally, you want to make sure that any sources of food that you're feeding your sea turtles come from an area that is not currently experiencing a red tide. And so there was also some things in the literature that suggested that perhaps dehydration was an effective treatment for red tide poisoning. I think there's more work that needs to be done here, but remember that these toxins are metabolized by the liver and then excreted by the kidneys. And remember that reptile kidneys are normally, the urine produced by them is isosthenuric. So those kidneys really can't concentrate urine. Instead, what they do is they decrease the blood flow through the kidneys. And so it's kind of counterintuitive. If you dehydrate these animals, they are actually going to decrease their renal blood flow, and that is going to result in those toxins sticking around for longer and potentially getting out to those peripheral nerves or into the central nervous system. So at least in my experience, it is better to go ahead and diurese these animals. And that is usually, again, you're going to provide supportive care, and that's going to include fluids. There was a good study done by Fauquet et al. Back in 2013, where they looked at brevetoxin concentration levels in a variety of sea turtles, and some of the levels are very high in these animals, and not surprisingly, many of these animals were in rehabilitation for very long periods of time, and it took a while for their brevetoxin levels to get back into that 1 nanogram per mil baseline or background level, which is really the lower limit of detection level for the commercial testing that's available. So in summary, again, in this particular study, it took anywhere from about 30 to 90 days for these turtles to go back to what would be considered normal background levels. So we really wanted to see if we could come up with a better way to treat these animals. And I was looking at this in seabirds at Crow all the way back in 2014, and we were having some very good success with using IVLE to treat seabirds with brevetoxicosis. So LMC and Crow wanted to collaborate potentially on looking at ILE and sea turtles. However, FWC still wasn't convinced that it was safe and effective, and so it was suggested that this should be tried in another species of chelonians that were not quite so endangered. And so a study was done that was published in 2019 looking at this in red-eared sliders, and in fact IVLE was shown to be both safe and efficacious in red-eared sliders, and so the next step was to try it in sea turtles. Again, one of the silver linings to the cloud of red tide was that that gave us an opportunity to look at using IVLE in a wide variety of sea turtles that were affected. So we had both sea turtles that were treated with IVLE and those that served as controls. So for all animals that came in upon admission, we would go ahead and take blood from those animals. The people who were doing the treatment were blinded as to who got IVLE and who didn't. And then we looked at clinical signs. We gave IVLE at a dose of 25 mg per kilo, and then we administered that at a rate of a ml per minute. And then we collected blood again at numerous time points after giving intravenous lipid emulsion all the way out to a couple of weeks. And the patients were observed by blinded observers throughout this study, and we found some really amazing things. Now, again, in terms of how do we measure brevetoxin levels? Well, there is a competitive ELISA that is commercially available, and the limit of detection for that assay is 1 to 2 nanograms per mil, and you can obtain that commercially. However, we were using a laboratory to look at the values.
I'm sorry, I don't know if you paused your video, but we just stopped listening halfway through this slide. Hi, can you hear me? I don't know if my audio is okay, but we stopped listening. I don't know if you put on pause.
Jamie, if you're there, we can't hear anything, and the video is paused on this slide.
I don't think they've realized it yet.
In our sea turtles, and these ranged anywhere from 1 to 93 nanograms per mil, and those higher values
Are you guys
were
still able to hear it?
And
Was that better?
Yes, thank you.
and in terms of
Oh, hold on. I think you're on this side. Okay.
And in terms of our loggerhead sea turtles, we had 9 of those that actually did get intravenous lipid emulsion therapy. And so you can see this particular turtle getting IVLE here. We would either give it by hand, or sometimes if they were really depressed and fairly somnolent, we could just put them on a pump and pump it in. And again, these animals had brevetoxin levels anywhere up to over 50 nanograms per mil. And in terms of their time of rehabilitation, it was, a variety of different times that it took for rehabilitation. But most of those guys got out of there pretty quickly, and it appeared that IVLE was in fact effective. Same thing for the Kemps. So some of them came in with some fairly high levels of brevetoxin, again, all the way up to 93 nanograms per mil in one case. And it's really interesting to me that in seabirds, what we see is that clinical signs are really not correlative with brevetoxin levels, and that's true in sea turtles as well. Instead, what we see is that the species of turtle or bird really seems to affect how they present clinically. And so the loggerheads were usually extremely depressed, often severe central nervous system signs, seizures, which is really one of the rare times I've ever seen seizures in sea turtles. And then the Kemps were usually not quite as severely affected, but they may be very ataxic in the water column and therefore were at risk of drowning. And those guys also seem to process the toxins a little better and usually ended up spending less time in rehabilitation than the loggerheads, who were a little slower to come out of it clinically. Green sea turtles, we only have 4 of those enrolled in our studies. Remember that greens represent a much smaller portion of all the sea turtles presenting for red tide poisoning, and this is probably because they are feeding on seagrass, which has less of an opportunity to bioaccumulate those toxins. And so you can see here that the levels in greens were much lower than the levels that we were seeing in loggerheads, and in particularly the levels that we were seeing in Kemps, which were quite high. Not surprisingly, it took these guys a lot less time to be clinically resolved and get out of rehabilitation. Now, this particular slide I know is a little busy, but the take-home message here is that in loggerhead sea turtles, we had 9 turtles that were in the ILE or treatment group, and then another 19 that were in the supportive care group. And so the ILE group is designated by this yellow line, and the supportive care group that did not receive ILE by the blue line. And so what we saw was that those that got intravenous lipid emulsion had a 50% reduction in their brevetoxin levels by about 300 hours, whereas those that just got supportive care, it took them over 400 hours to see a 50% reduction. And in terms of time that it took these sea turtles to get to those baseline 1 nanogram per mil levels, it took the treatment group just a little over 1,000 hours, whereas the supportive care group, it took them nearly 2,000 hours. And we saw similar results in the Kemp's Ridleys, although overall it took them less time to process these toxins. So the treatment group had a 50% reduction at just a little over 100 hours, whereas the supportive care group, it took them nearly 200 hours to see a 50% reduction. And so again, some differences based on the species of sea turtles, as well as how rapidly they seem to be able to get rid of those toxins. In terms of survival rate and symptom reduction, 17 out of 18 of these animals survived to release, so that was a 94% survival rate, whereas with the standard supportive care group, those guys only appreciated about a 62.5% survival rate. But the most stunning revelation that we had was that sea turtles who got intravenous lipid emulsion had complete resolution of their symptoms in about 24 hours and were usually able to go right back into the water, whereas those that were only getting supportive care sometimes had to be dry docked for several days before they were mentally competent enough to not risk drowning in the water column. In terms of release time, with the treatment group, it was anywhere 26 plus or minus 13 days and a range of anywhere from just a couple of weeks to up over a couple of months. And again, a lot of these turtles had some complicating factors like sepsis that had a significant impact on their time to release. Again, a lot of these loggerheads were fairly anemic when they presented and often had a heavy epibiota load. So a variety of things that can contribute to release, but remember back in that 2013 study that what they saw was that for most sea turtles it was anywhere from 30 to 90 days until those animals were released. So certainly we're doing better than that. In terms of conclusions and future directions, definitely this treatment was both very safe and effective at 25 mg per kg. And since that time, I have used dosages all the way up to 75 mg per kg, and that is still safe. I will just say that it does take a lot longer because you're only giving a mil per minute. It is obviously going to take you a lot longer to give that ILE if you're using the higher dosage rate. So simply from a clinical efficacy and efficiency standpoint, we found that 25 mg per kg seemed to work fairly well, and that it was very rare that we had to ever repeat treatment for any animals over the years. Symptom elimination was very rapid. There was certainly an increase in survival rate. And I just wanted to point out that it is probably safe to use IVLE in any species of animal. So we've looked at it in a wide range of birds, marine mammals, sea turtles, and it has been very effective. It is also effective not just for natural harmful algal bloom toxins like the ones that I've listed here, but potentially also for man-made medications. For example, we have seen inadvertent overdoses with propofol, and IVLE is excellent. So if you have a turtle, whether or not they got an accurate dose, if they're taking a while to come around from a dose of propofol, you might try giving them a little IVLE and seeing if they don't come around a little more rapidly. We had one sea turtle that was inadvertently overdosed by an intern at about 10 times what would be the standard rate. And that turtle slept all day until we finally thought about trying to give it IVLE. And then it was awake about 10 minutes later after we gave the IVLE. So really impressive. There are other lipophilic potential toxins like ivermectin that you would obviously never give to sea turtles in the normal course of things, but if somebody gave it accidentally, IVLE would be a potential treatment for that. So just keep that in mind for any potential lipophilic toxins that you think your sea turtles may be exposed to. And then in terms of how do you protect your health if you are working on a beach that is affected by red tides? And there have been some really interesting anecdotal reports and studies looking at how far can these brevetoxins travel inland. And right now the best guess is they can travel at least a mile inland, depending on, you know, how strong the winds are and that kind of thing. And so my recommendation is if you are working on a beach that is experiencing a red tide, you do want to wear at least a surgical mask, and this will provide up to 40% protection for you from inhaling those brevetoxins. You could also potentially wear a respirator, which would provide up to 98% protection. You may also want to wear goggles because one of the primary clinical signs that our people who work the nesting beach were reporting is tearing and irritation of the eyes, very red eyes, very itchy eyes. That was a big thing, as their eyes were itchy. And then certainly you can have lots of respiratory signs. And so not only do you want to try to wear a mask, but when you come back from the beach, you may want to wash your clothing, and you may want to change out your shoes or have shoes like boots that you can just hose off. If you have a much more feel better within an hour or two after leaving the beach, but for asthmatics, those clinical signs can last up to a day or longer. Also, if you live anywhere near the beach or you're driving near the beach, you want to keep your windows closed and the air conditioning on in your home or car if you're within a mile of the some other tips that may help is if you're asthmatic, make sure you keep your inhaler with you at all times during red tide season. You may want to carry saline nasal or eye rinse to flush the toxins out of the nose and eyes. You can potentially try a steroid nasal spray or steroid eye drops or antihistamines or nonsteroidal anti-inflammatory that your body is having. And so just out on the beach. Other work that has been done here outside of what we've done looking at IVLE, Peralta et al. Had a good study that they published back in 2016 looking at maternal transfer and sublethal immune system effects of brevetoxin exposure in nesting loggerhead sea turtles. So they took plasma samples from nesting females, and those did test positive for brevetoxins via ELISA. And then in those same nests, if they looked at the dead in nest hatchlings, 100% of livers and yolk sacs from those dead animals tested positive for brevetoxins, and 70% of the eggs that were tested positive. And also brevetoxin concentrations in those nesting females actually positively correlated with gamma globulins, again indicating that there is maybe some immune modulation going on as a result of that brevetoxin exposure. And one of the questions that I frequently get is how come we see sea turtles or seabirds or other animals presenting for brevetoxicosis when there's not currently a red tide? Well, there's probably a couple of potential answers for that. The first answer is that there may be a red tide and we just can't find it. So despite all of our very sensitive satellite data imagery and all of the very sensitive monitoring they do to test the water and find out how many cells per liter there are, sometimes those toxins bloom at different places in the water column, or maybe they're further out to sea than where we're testing. And sea turtles obviously swim around, and so they may be exposed through those methods. Again, hatchlings may be exposed from either the water washing up over the nest or from what they got from their mother. And then the other possibility is persistence in the food chain. So there was a really good study done where they looked at oysters that had only had 2 days of exposure, and that was only at a count of around 62 million cells. And just to give you a frame of reference for that, at about 10,000 cells per mil, you will have respiratory signs in people, and you'll potentially begin to have fish kills. And in some bad years, for example, in that 2018 year over on Sanibel, we actually documented cell counts that were up over 2 million cells per liter. So it can be really, really severe. But from just that 62 million cell count, they had 6 months of persistence after just 2 days of exposure in those oysters. And in seagrass, there has been documentation of persistent levels of brevetoxins up to 8 months after a bloom. And in one study in sea turtles, there was absolutely no correlation between body mass and clearance rate. So you would think, you know, if they're smaller, they have a higher metabolism rate, and so maybe they clear toxins faster, but that is not necessarily the case. Also, again, just repeating that there is very little correlation between brevetoxin levels and clinical signs, and there is also no correlation between brevetoxin levels and what their prognosis is. And so that is not a good predictive factor for survival just because they have lower levels. And with that, I'll go ahead and wrap it up and take any questions. Just wanted to very quickly thank our partners over at Crow and Florida Fish and Wildlife. All of this work was conducted under FWC marine turtle permits. And we also wanted to thank the Morris Animal Foundation for funding the intravenous lipid emulsion therapy as a treatment for brevetoxicosis in sea turtles. And thank you guys so much, and I will take any questions.
Okay.
Thank you, Heather. That was a terrific presentation of a fascinating subject and a really important contribution to sea turtle medicine. I don't know, Mariana, if we have anything question-wise on Facebook, but I certainly have a few questions.
Great.
If you have a few moments, I know we kind of had
Of course.
a late start. You mentioned in one of the slides the possibility of using this therapy for toxins outside of brevetoxins.
Right.
And if you can, have you had direct experience with that? And
Absolutely. Yeah,
Okay.
and one of my best experiences was in a sea turtle that accidentally got an overdose of propofol, and that sea turtle slept all day. We kept waiting for it to wear off, but we were ventilating it. It wasn't breathing on its own. And then I kind of thought, you know, I know propofol is lipophilic. Maybe we'll try this IVLE. We gave the IVLE. 10 minutes later, that animal was wide awake and doing great. So yes, it is very efficacious for any of the lipophilic toxins. And, you know, sometimes any medication, so it's used in other species and certainly could be used in turtles as well. If ivermectin was given accidentally, that's one example of something that, you know, would respond very well. So you just have to look at the lipid coefficient factor of whatever medication or toxin you're looking at. And the higher that factor, the better this medication is going to work.
That's great. Yeah, that's great news. And so useful across, as you mentioned, across you know, many applications.
Yeah, and many different species. So I've used it in birds, for example, euthanasia solution. If you gave accidentally there was ingestion of euthanasia solution, or it was given accidentally where it shouldn't have been. There is the potential. So there's been cases of eagles or other scavengers who ate carcasses of animals that have been euthanized, and now they've got euthanol toxicosis, and those animals respond very well to IVLE.
Excellent. That's a great piece of information. In your paper, you had a couple of just very brief lines about the possibility of adding a prokinetic to therapy to increase the transit time, or decrease the transit time rather, increase the transit of potentially contaminated food items. Have you done that, and would you recommend that?
I mean, I do it because the problem is you definitely see, obviously, brevetoxins are neurotoxins, and they're affecting nerves in every part of the body. And again, depending on the individual, you see different things. And I also did see different things with different species. But there's no doubt across the board, every single turtle gets ileus. And that's really a problem. That food just sits there and rots, and all that bacteria translocates across the gut wall. The next thing you know, you've got a septic patient. So two things that I've added in that I think are really important in terms of treatment are both your H2 antagonist drugs, because I think these guys are predisposed to GI ulcers. So I definitely look at putting them on like injectable famotidine. And then I like the prokinetic agents. Whether or not they help, I think the jury is definitely still out on that, but they don't seem to hurt. And I definitely use both metoclopramide and cisapride.
Terrific. That's great. I have just a question about more on a technical basis for perhaps a hospital staff, somewhere around the world in delivering ILE. If the lipid gets extravascular,
not a problem. Yeah.
Not a problem. Okay. And
it happens all the time. I mean, you really try.
That's what I'm getting at. Yeah.
To get it in the vein and keep it in the vein, but some of these guys, are not very lethargic and don't really appreciate it. And I think a lot of them are, they are neurologic. And so, keeping them still to give that IVLE is problematic. And we don't place IV catheters. So we just sit there and hold the needle in place and, give it by hand. And we keep rechecking to make sure, we aspirate back. We use a 3-way stopcock and a butterfly catheter. And we just keep checking to make sure that we're still in. But I admit it, I know that there have been times where it's been extravasated, and I have never seen a problem with it. So I'm a little more careful with TPN. If I'm not 100% sure that I'm in the vessel, then I don't like to give it at all. But I have not had a problem with just the lipid component. It seems to do fine.
Great. And kind of a follow-up on the technical side, the supportive care when you're diuresing, can you speak to the fluid rate that you're giving?
Yeah, I just give maintenance fluid rate, so the 20 mils per kilo per day. If they come in dehydrated, then I certainly account for that in my fluid rate, and we correct that dehydration over the next 48 hours. So we don't push the fluids super fast. We do make sure that their head is elevated, because I think particularly if you're using the cervical sinus or jugular veins, if the head is down in relation to the rest of the body, I do see sometimes fluid accumulating around the head and neck. And so we do try to keep their head propped up on towels, even if they're at a little bit of like a 20 or 30 degree angle with the head up and the tail a little more down. I think, that can help in terms of making sure you don't have problems with cerebral edema, but I haven't seen any problems with that. They get the IVLE and they just improve so rapidly that I think a lot of the other things that we used to see before we had IVLE, we're really not seeing those problems anymore.
Terrific. Yeah, I mean, I've used this therapy myself many times, even if it's just suspected, even if there's, like you mentioned, there's no brevetoxin anywhere in the water, and it doesn't do any harm, it
Right.
appears. So that
Exactly.
there's no harm in trying it. And
Right.
it's a readily available drug in many places around the world, not everywhere, but it can be stored at room temperature for quite a long time too. So
That's correct.
that's one advantage. I think we don't have any more questions that I can see
Hi, Mac.
on.
Sorry to interrupt you. Just to let you know, there's only one question, and it was about if it is readily available, the IVLE.
We get it from a company right here in Florida, but my understanding is they'll ship anywhere. So I can put that information. If I send it to you, can you guys post it?
We can.
Okay. Yeah, I'll send you guys the contact information of where we get it from. But I think anybody who makes TPN can make lipid emulsion. Baxter produces it commercially. So there are several places where you can potentially get it.
Yeah, I agree. I think in terms of a compounding pharmacy, they'll have access to that 20%. Usually, so there is some, many options potentially to acquire the emulsions.
Yeah, the brand name is Intralipid, and Baxter manufactures it, and it does have quite a long shelf life. Great.
Well, I think we'll let you go, Heather.
Thank you, guys.
Again, it was a wonderful, wonderful discussion and such a fascinating study, a group of studies, and we look forward to seeing future directions and where you take this. I know you're at LMC now, which they're so lucky to have you, and it's going to be great to see how things develop with ILE there and everything new that you have planned. So we'll be sure to have you back with the latest and greatest things that you're doing there.
Oh, excellent. Anytime. I'd be delighted. Thank you guys so much for the work that you do and for having me today.
Thanks, Heather. Okay, bye-bye.
All right. Bye-bye.